Morning. We're here at the Robert Mills building. It's an historic building. It was built by the first federal architect, Robert Mills, and this is the original building of the South Carolina Department of Mental Health. So it was built in 1822, long time ago, and we're here to interview for Public Health 700, Michael Smith and Beth DeSantis. So we're here today to talk about maternal and child health, and in the background is the original building of the South Carolina Department of Mental Health and now the South Carolina Department of Health. And so our topic today is maternal and child health, a very important public health topic.
Hi, Dr. Bird.
Hey, Allison. What are you doing here?
I'm interning today.
Wow, that's great. So, Allison, what are you doing here specifically today?
I'm currently an MPH student at the Arnold School of Public Health in the HISPM Department, so Health Services Policy and Management, and I'm currently working with Martha Hinson in the Maternal Child Health Department.
Wow. So there are lots of important public health topics in maternal and child health, and that's what we're here to explore today.
Hi, my name is Mike Smith. I'm the maternal and child health epidemiologist here at DHEC, and I'm also the director of the Division of Research and Planning within the Maternal and Child Health Bureau here at DHEC. I have a master's degree in biostatistics from the University of South Carolina, and I'm also currently a part-time doctoral student in biostatistics at USC working on my dissertation. We're going to talk to you today some about maternal and child health, particularly maternal and child health in South Carolina, and MCH is the abbreviation that we use for maternal and child health. So MCH is important to everyone because everybody has a mama, everybody was a baby, everybody was a child, and your experiences both when you're in your mother's womb and as an infant and as a child have a large impact on the adult that you become. So with that said, I'm going to introduce you to my boss. Her name is Beth DeSantis. She's the Bureau Director for the Bureau of Maternal and Child Health here at DHEC. And if you ever have a chance to work for her, I highly recommend it. She's fantastic to work with.
Hi, as Mike said, my name is Beth DeSantis, and before I start talking about myself, I really want to talk about how wonderful it is to work with the Division of Research and Planning here in MCH, because Mike and his group are the people who help us every day understand what's going on out there in the world of moms and babies. Without that kind of research, without that kind of data, there is no way we could ever make a difference in the lives of moms and babies. So that's Mike, and that's what he does, and we really appreciate it. What we do also is work with moms and babies on a daily basis to make sure that the environment that we are growing our children in is an environment that helps us to improve the health of everyone across our entire state, and by extension, the United States and the world. The health of everyone combined makes a difference. So I am supposed to be introducing myself, but as you can see, I get very excited about what we do. So my job right now is to introduce myself. I'm Beth DeSantis. By training, I am a nurse. I went to school at University of Virginia where I got my bachelor's in the science of nursing, and then I became a labor and delivery nurse. So again, right from the beginning, the moms and the babies were the most important part of my career choices. I was lucky enough to be able to go to the University of South Carolina to get my master's degree and become a nurse practitioner, a women's health nurse practitioner, because I learned from my experience in labor and delivery that we needed to look at what was happening with moms before they got pregnant so that we can make a difference in their lives after the birth of the baby. So maternal and child health has so many different pieces to it. It starts with the mom, then she becomes pregnant, then she has the baby, and the baby grows into a child and then an adult themselves. We touch the lives of all moms and babies in South Carolina, and thank you for listening to us talk to you about that.
So we're going to talk about some of the maternal and child health priority areas and problems that are particularly important in South Carolina right now. Some of the major areas of importance are infant mortality, obesity, particularly childhood obesity, and access to care. With infant mortality, it's a worldwide problem, right? There are high rates of infant mortality in various areas around the world, but in the U.S., the infant mortality rate as a nation is quite high compared to other developed countries. So within the larger framework of the world, the U.S. has an overall high infant mortality rate. And then within the United States, South Carolina has one of the highest infant mortality rates in the country every year. So this is a major problem in South Carolina. Beth, you want to talk about what we're doing in infant mortality in South Carolina?
Sure. Infant mortality in South Carolina has so many different facets to it. It's really looking at what is harming our moms or harming our babies. What is causing our babies to not live past their first year? So when we look at that, we look at the system of care that we have, the perinatal system of care in our state. We actually have a very good one, and we will go into more detail in that in our lecture. We look at our newborn screening process. What happens? How do we make sure that as a child is born into our environment, are they healthy? Do they have any genetic diseases? Do they have any hearing problems? Do they have anything that's going to develop a speech problem later on, like a cleft lip or palate? Then we look at broader issues, like what are our actual birth outcomes at the hospitals? And we help hospitals understand how they can affect change within the actual hospital and maybe within our payer system to make sure that we are getting reimbursed for services that will help babies be healthier. And as that happens, I'm getting a phone call over here, see, so there's always some more work to do. And then the last thing I would like to talk about in infant mortality is actually some efforts to help with children when they go home, safe sleep, for instance. How do we help to make sure that we don't have so many children dying from sudden infant, I'm sorry, I'm going to say it wrong, SIDS. So those are all things that we do in the world of infant mortality to try to affect the health and improve the lives of babies.
Baby mine, don't you cry. Baby mine, dry your eyes.